I want to talk about what the ICE raids are doing to children's health. I'm a scientist, but before that, I'm a father. Right now, the federal government is carrying out raids that detain families, including young children, in holding facilities for weeks or months, sometimes under deeply degrading conditions. And even for children who are never detained, these types of raids inject constant fear and instability into their lives. From a medical standpoint, the consequences of that kind of fear in children are clear, they're measurable, they're extremely dangerous. In pediatrics, they call this adverse childhood experiences, severe emotionally stressful events early in life, and they're one of the strongest predictors of poor lifelong health. Large studies following hundreds of thousands of children show very clearly the kids with significant early trauma have dramatically higher risks for diabetes, for heart disease, for depression, for cancer, for substance use, for violence, and for suicide. Many of these are multiple-fold increases in risk. These experiences affect children biologically and sometimes permanently. What we're seeing play out right now is the creation of this kind of harm for children in real time. Sudden loss of caregivers, constant uncertainty about safety and family stability, the kind of fear that reshapes how children sleep, eat, learn, fear that keeps families away from schools, away from doctors' offices. And at the same time, federal health officials at the highest levels publicly fixate on risks to children that are tiny and theoretical, hypothetical vaccine side effects, measured in extremely small probabilities, endless debates over ingredients and food colors. Meanwhile, entire communities of children are living in extreme fear of the government, day and night. And of course, recently, some powerful platforms, some of the biggest ones, have punished this kind of talk. So I encourage you to join me somewhere that doesn't. As a father, I want to be clear about where I'm coming from. I see our daughter in every other child. I don't care where a child was born. I don't care who their parents are, or what language they speak, or what paperwork they hold or don't. I care that children feel safe, that they aren't lying awake in bed at night hungry, wondering whether they will be together with their family in the morning. Children's bodies don't care whether extreme stress and harm is coming from a virus or some type of toxin, or from poverty, or directly at the hands of our government. The only thing their small bodies know is that they are in danger and that they're being harmed. And right now, children are being harmed at scale.